it does affect the quality of life, sort of fertility, long-term health outcomes. Perhaps you could expand upon that a little bit more.
Yes. So menopause after cancer is slightly different for most women. That's because you're either having it because of surgical reasons, somebody has had to remove the ovaries, or for medical reasons because you've had strong dose of chemotherapy or radiotherapy, and that often plunges you into menopause over a short duration of time. So you're likely to have much more severe symptoms, much more persistent symptoms, unless you're doing something to address those symptoms. And you're probably younger when you have cancer and menopause. So it has much more long-term effect on your brain health, on your cognition, on your heart health, as compared to somebody having a gradual natural menopause later in life. Fertility-wise, of course, if you've had a surgical menopause, you have chemotherapy, radiotherapy, it's going to either completely take away your fertility if it's surgical. If it's chemo, radiation, most of these are quite toxic and will damage many of the eggs or follicles in the ovaries. So you may be left with menopause and may not be able to have children with your own eggs. But of course, some of these women will recover. And that's really very important to remember, that chemotherapy, radiotherapy can affect individuals differently. There'll be some chemotherapy regimes or some radiation regimes where the ovary may bounce back, may come back to some hormone function, may start ovarian egg activity. So in those situations, your fertility may still be possible, and it's always important to talk to a specialist if you are really interested in taking that further.